Today we're going to talk a little bit about surgical experience for the patients. We're trying to do our best for the patients. We even bought this electronic board so we can record the video. Surgery is a serious event for the patient, and please take it seriously because you can improve your pain, your experience after and before surgery as well if you listen to this and talk to us more. So basically, preoperative period essentials. Try to have a bowel movement day before surgery. The closer to surgery, the better. I don't do any enema. Sometimes if you need, you can do enema. Take a lot of vitamin C. Vitamin C, 1 gram, which is 1,000 milligrams, every 3 hours, like 2-3 days even before surgery. Light diet, so don't eat steak for 1 or 2 days before surgery. Light diet, 1-2 days prior to surgery, broth, some vegetables, in general even less fruits because fruits can cause some bloating, by the way. No food or drink, I mean like juices and water before surgery, meaning no food or drinks after midnight. Except if somebody is taking cardiac meds, you can take them in the morning with a sip of water. Stop blood thinners 3-7 days before surgery as instructed. Of course, if somebody needs clearance from the specialist, they will need clearance. Blood work before surgery. Then day 1 after surgery. First, drink plenty of water. Remember, you had anesthesia, you had local anesthetic injected, so you need to wash out those toxins from your body to start healing properly. And stay hydrated, make sure your blood pressure is stable, your heart rate is good. Then you can start light diet. Again, no steak for first 2 weeks after surgery. Take Tylenol together with NSAIDs, meaning like Advil, ibuprofen, Motrin. Also, take a lot of vitamin C, 1,000 milligrams or 1 gram vitamin C. Better take it, buffer it. We have in our office, buffer it. So it's easy on your stomach, or you can take liposomal as well. Every 3 hours. Also, after surgery, start in the morning, sitz bath. Sitz bath with 1-3% of regular table salt and add some soap. Also, to be more advanced, you can borrow from us ozonator or buy one and ozonate salty water. When you ozonate salty water, we will show the video, we record video how you do it at home. It's very simple. So this speed up, facilitates, improve healing, and it also kills any infection that interfere with the healing as well. The bath, sitz bath should be warm, except if you ozonate water. Water, I would say, should be a little bit colder, like room temperature. Don't warm it up too much because ozone doesn't dissolve in high quantity when you warm up the water. And you can do sitz bath 15-20 minutes, 1-3 times a day. It usually helps with pain as well. And by the way, if somebody cannot have bowel movement first day, or it hurts, you can do bowel movement in sitz baths. That's how people do it. From my experience, they feel better. They feel less pain. By the way, we're talking about colorectal, specifically anorectal procedures, which can be very painful. So make sure you have bowel movement day 1 after surgery. And we always prescribe laxatives. You can take laxatives from pharmacy we prescribe. You can also take, in my office, we have my formula, health formula, or reset. You can take them together. It's a natural laxatives. They give you some extra energy and improve recovery. So that's another option we have in the office. Now, some bleeding after surgery is expected because I called patients answering the phone call, and they said, call me, I'm bleeding. So when I call, they say, oh, I have few spots of blood. So you don't need to call us if you have a little bit of bleeding. That's normal. In case of bleeding, fever, chills, please message to my office. Email, it's on the business card or instructions, or text to our office mobile phone. When it's on the weekends or after 5 p.m., if you have emergency situation, I hate to say that, but you need to go to emergency room or call 911 or go to on your own if you can to emergency room of the hospital where we did your surgery. Now, very important, that's what we have. It's a very unique measures. We do very unique techniques we do in our office to improve, to facilitate healing. We go more than routine standard practice in general. So what do we do? What do we offer to improve healing, to decrease pain? And sometimes we can decrease pain even to 0 after surgery when we do some things. So, like I said, to facilitate healing, decrease pain after surgery, ask about few things. If you prefer to have this approach, vitamin C high doses IV before surgery, ozone preoperatively. By the way, if somebody is in, like 10% of my patients, they have a lot of pain after surgery. They can come to the office even a few days after surgery. I can do something to dramatically improve pain. And I use ozone as well. Also, people can take Dr. Fulmer's Reset as well, and they can use ozonated healing oil, which is basically made here in the office. So that's briefly about all major essentials. If you, of course, we're going to miss something because everybody individual, maybe we need to discuss more. So please text us, be in touch.